session of the Commission on Narcotic Drugs. At the outset, I'd like to thank the Government of Switzerland, the Vienna NGO Committee on Drugs, and the Alliance of NGOs on Crime Prevention and Criminal Justice for co-organizing this side event, a very important side event, alongside with UNODC Civil Society Unit. So my name is Billy Batware. I am a Program Officer at the UNODC Civil Society Unit, and I will be moderating this session with my co-speakers that I just presented, with whom I will, of course, present a little bit later as well. So just a few words really to set the stage for this side event. As we know, cyberspace, on one hand, one can say that serves as an enabler for organized drug criminal activities, for criminals to exploit the vulnerable groups, such as young people, who spend quite a lot of time online. And COVID-19, of course, acts as an accelerator for this particular challenge. And on the other hand, it could also be said that technology could be used as a tool for opportunities to address drug-related challenges. And indeed, we do know that technology is being misused in support of illicit drug markets, as darknet sales continue to grow, as evidenced by the 2021 World Drug Report from UNODC, which shows that drug markets on a darknet are now worth about 315 million in annual sales. Of course, this in comparison to the general picture of the drug market might seem small, but this number seems to be increasing. So the expansion of online drug markets to social media, for example, and popular e-commerce platforms further suggest that their accessibility is widening. And in line with this trend, the 2019 Ministerial Declaration of the CND, member states expressed concerns that criminal misuse of information and communication technologies for illicit drug-related activities was increasing. And this increase was thereby identified as one of the challenges to be addressed in order to effectively implement the joint global commitments. And some of you who might have followed last year's intersessional meetings of the CND, you might have noticed that this urgency was also addressed during those thematic intersessionals on the implementation of all international drug policy commitments, which was following up on the 2019 Ministerial Declaration, of course. And this particular thematic discussion actually included a dedicated session on increasing links between drug trafficking, corruption, and other forms of organized crimes, including trafficking in persons, trafficking in firearms, but also cybercrime and money laundering. And in the context of this criminal misuse of information and communication technologies for illicit drug-related activities, we do know that civil society is an important partner in addressing these challenges, and therefore the need for this side event today. And it is, of course, of utmost importance to discuss then how civil society can effectively contribute to addressing crime and on other drug-related challenges in a cyberspace, and how strong partnerships that we have been hearing throughout the CND, and in this case, in the context of drug trafficking in a cyberspace, how these partnerships can be leveraged to effectively address these challenges. So today's side event will include presentations of the colleagues that I just mentioned from civil society, and the aim of the side event is really to shine the light on promising practices, opportunities for actions to address current challenges in a cyberspace. So our discussion will really only focus on how civil society work can effectively contribute to addressing drug-related challenges in a cyberspace through partnerships. So with that, I really would like to welcome our first speaker, Dr. Kawar Deep Kaur, who is from the South Asian Drug Addictions Research Council. And of course, we will have Jorge Herrera, who is from Instituto RIA, and we will have Ian Tennant from the Global Initiative, as well as Anna Ivati from the NGO Alliance on Crime Prevention and Criminal Justice. So let me just check whether Dr. Kawar is with us and is ready. Welcome, and it's really a pleasure to have you with us. I just wanted to welcome you by asking you this question. As I just mentioned, evidence show that civil society are key partners in addressing drug-related challenges. So I will be interested to hear from you, and I think the audience will be interested to hear from you. How is civil society being instrumental in connecting relevant institutions, including the private sector and governments, in mobilizing community awareness for policies and practices? And in your view, are there any strategies that have, proven to be successful in strengthening policies in response to drug trafficking online? So Dr. Kawar, please, the floor is yours for about 10 minutes.
Thank you. Thank you so much, Billy. I thank VNGOC for this opportunity to be able to make an intervention on responding to drug-related challenges in the cyberspace, vulnerabilities and opportunities to engage the civil society. The internet is an extremely powerful tool. Anyone can simply connect online and can get more or less anything they need delivered to the door. And this increasing dependence has also enhanced opportunities for criminal actors to step in and take advantage. And the scope of harm to the public is greater when the internet is involved. Recent years have witnessed a dramatic growth in the global online market for a variety of drugs and psychotropic substances, fueled by the proliferation of powerful information and communications technology. Online drug trade has expanded exponentially, facilitated by secure communication channels, cryptophones, cryptocurrencies, darknets greatly altering the crime landscape with its own architecture, technologies, and practices. Although dark market-based drug distribution is only a minuscule but gradually growing share of the global trade in illegal drugs, it has transformed global drug distribution network and with long-term and serious implications. In many ways, crypto markets constitute the perfect storm of potential crime hysteria and moral panic. They combine two emotive and often little understood issues of illicit drugs and darknet. Many of the concerns regarding crypto markets are well-founded. They directly facilitate drug-related crime. They are accessible to anyone with an internet-enabled computer. A bank account, a minimal level of technical proficiency, including to children, and have also been implicated in the death of drug users around the world, especially young people. An Inter-American Drug Abuse Control Commission report had highlighted how the internet, unlimited by time and space, was becoming a cost-effective way of producing, using, marketing, and distributing new drugs. As per a research publication, the crypto markets have facilitated hundreds of thousands of illicit drug exchanges, likely worth more than $2 billion US. Door-to-door delivery of a greater volume and a wide range of illicit drugs have had serious repercussions. A reported increase in fatal overdoses, as that reported from the United States, particularly involving the sale of fentanyl-laced counterfeit pills that have caused the death of teen and young adults in at least 15 states. This brings us to the issue of internet pharmacies that have resulted in another growing problem, that of prescription drug misuse. While there are several legitimate internet pharmacies, the majority sell drugs without safeguards against diversion. With no regulatory control over drug advertisements on the internet, to cite an instance from India, which has witnessed a surge in the number of illegal online pharmacies. Many of them involved are selling illicit produced pharmaceutical controlled substances and counterfeit controlled substances represented as legitimate pharmaceuticals. A 2019 national survey and pattern of substance use in India highlighted that around 1% of the population aged 10 to 75 had misused pharmaceutical opioids in 2018, and that an estimated 0.2% of the population, that makes up 2.5 million people suffering from drug use disorders related to pharmaceutical opioids. There is an obvious challenge here for law enforcement to not only keep pace with new technological developments, but to effectively counteract technology-enabled crimes. But combating this is not something that law enforcement can or should shoulder alone. It needs not be overemphasized here how often conventional and rigid enforcement practices and approaches, including surveillance, can result in violation of public liberty and right to privacy, the latter being a fundamental human right recognized in the UN Declaration of Human Rights, the International Covenant on Civil and Political Rights, and in many other international and regional treaties. There is a clear and outspoken need for sharing best practices, knowledge, and building expertise, as well as in building up a multidisciplinary approach. A critical factor here is to develop working relationships with private industry and the academia in ways that can bring in new information to decision makers in a variety of ways, through research work and through bringing diverse ideas and opinions. Prevention is a key non-investigative measure that must also be considered. Regulatory system strengthening and harmonization of legal and policy frameworks to meet new challenges and pursue a shared commitment towards combating crime where these technologies are involved is crucial. This demands cooperation between different sectors as well as different stakeholders. Although there are dominant challenges that the civil society organizations face in terms of relevance, reputation, and quality of work, security issues, overt critical analysis of the state and policy-making institutions by them that account for their complex position. Yet, by building bridges with policy-making institutions, civil society organizations can and should become instrumental in connecting relevant institutions and private sector and cooperate with state institutions in mobilizing community awareness generation, including advocacy for policies and practices to deal with this multi-dimensional threat. As it is said often, it takes two to tango. Meaningful civil society involvement requires input and action from both policy and decision makers. And if policymakers are hesitant, civil societies should be ready to be able to fulfill a proactive role. Thank you.
Thank you so much, Kawar, for this very useful contribution to this discussion. And it's very, of course, I mean, when you put it in the context of India, and I would like to ask you a follow-up question to this, in terms of the numbers, sometimes when you talk about 1% of the population, sometimes it's almost really insignificant. Of course, in the case that you are mentioning, where people are having to come across and use illegal pharmacies, then of course, I mean, even one person is too many. In the case of India, 1% looks like it's almost like 5 million people. So basically, this is a huge number of people who are having to use these illegal online pharmacies in the context of falsified medical products, and the impact of that could be very huge for the communities. And that is my follow-up question. What is, if any, what is civil society groups, civil society organizations in India is doing to, in the context of advocacy, for example, raising awareness about these issues, these online pharmacies? What are some of the work that we are seeing in India that civil society is doing for the communities to address these challenges?
Evidence, Billy, as yet is hard to come by, because as I mentioned, and I would again like to reiterate, that it takes two to tango. So civil society organizations in India, basically they have been active and have been playing a proactive role as far as availability of opioids for palliative, care is concerned. And I think it is a step playing a very, very proactive role when it comes to highlighting issues about the misuse of pharmaceuticals and the rise and the burgeoning cases of prescription drug misuse. The civil society in India, as I would not say they have maintained a silence, but I would say They have indulged in more of media advocacy actions, in capacity building, in building coalitions, and in knowledge and providing knowledge and independent expertise. So basically, information, consultation, dialogue, and partnership, but to emphasize that they are as yet in a nascent stage and lot of effort on their part is needed. So there is some kind of an hesitancy because maybe the policy environment, it's not a very enabling policy environment because it's still the tone and the tenor of the narcotics legislation in the country is still very much, it is more of a zero tolerance approach. So it's not a very enabling policy environment. So voices sometimes are being stifled. And so I think whatever, within this context and within this stifling regulatory environment, the civil society organizations in India, with their raising concerns and voices, yet in their own little way, through steps that I outlined, capacity building, media advocacy actions, they have been bringing this issue to the forefront.
Excellent. Thank you so much once again for your contribution, Kawa. We will get back to you. Of course, please stay with us. So we'll get back to you later on. And the next speaker basically would, I think, try to make sense of what you just presented. So our next speaker is Jorge Herrera from the Instituto RIA, as I just mentioned before. Jorge, thank you so much once again also for joining us, and I welcome you to this event. As Kawaro just mentioned, of course, giving the case of India, but also kind of painting the picture of the dependencies that also leads to opportunities for criminal activities with regards to drug trafficking. COVID-19 has made this even a bigger challenge, obviously. So from your findings, what do you think is a business dynamic here in cyberspace? In other words, what I'm trying to say is, who is selling online, who is buying online? We know that there's young people, for example, spend quite a lot of time online. And what are some of the most popular drugs that from your research, that we see being sold online? And are there some of the steps, in your opinion, that can be taken to strengthen multi-stakeholder cooperation to counter this issue? So Jorge, please, the floor is yours.
Thank you very much. Well, hello, my name is Jorge. I would like to thank the VNGO committee to allow me to give this presentation, and UNODC and the Swiss Confederation and the Alliance of NGOs on crime prevention and criminal justice for convening this side event. Of course, to the panelists for the presentations, the audience for their interest in this topic. Thank you for the presentation. And I would like to briefly introduce Instituto RIA, which is an organization I co-founded in Mexico, where we are mainly doing research and advocacy on public policies with a social justice approach. We've been in the discussion of drug policy reform for more than 5 years. And I'm currently doing research at a graduate program in political economy at NYU. Next, please. So today I'm going to speak about the trends in drug use in the deep web. Specifically, based on data from the Global Drug Survey, and to explain the problems derived from these dynamics, highlighting the projects on the ground that are providing innovative solutions. The Global Drug Survey does have a report specifying the impacts of COVID in drug use trends. However, I'm not including a lot of data of COVID during the COVID pandemic here, because that data is more reliable when looking at specific country cases because of the lack of a wide sample. No, the GDS is an effort that since 2012 it has collected data from around 1 million people worldwide, inquiring about the drugs that people use. We at Instituto RIA translate the survey to Spanish and implement it in Mexico each year. And the GDS uses an encrypted online platform to collect anonymous drug use data from across the world, aiming to promote honest conversations about drug use and to help people use drugs more safely, regardless of the legal status of the substances. it is important to highlight that this is not a prevalence study. The GDS data are from a non-probability sample, and the findings are not representative of the wider population. However, the data can be used to describe patterns of drug use and to identify new drug trends. Everyone is invited each year to answer the survey, both people who use either illegal or legal drugs, including coffee, alcohol, tobacco. The majority of participants tend to be young, experienced with the use of illicit drugs, and that are studying or that are employed. And the deep web markets, or the crypto markets, have now been operating for more than 10 years since the launch of Silk Road in 2011. And for those who are not familiar, the deep web is an online market where site owners, vendors, and buyers, three actors, are able to remain relatively anonymous as their IP addresses are covered. No? Purchases are made using a decentralized virtual cryptocurrency, such as Bitcoin, which can also be used relatively anonymously. And here we have some graphs from a 7 years report comparison. The most reported substances to be commercialized in the deep web, and I believe that that answers the question of who is buying, who is selling, what are the preferences. Well, the most common substances are MDMA, LSD, cannabis, cocaine, 2CB, magic mushrooms, ketamine, and new psychoactive substances, which are drugs that are novel, so they are not under international control, and that may pose higher risks to the health of people who use drugs because of the uncertainty of their compositions and their effects of these substances. But year on year, the GDS has noted a rise in people using these markets. These trends suggest stability over time, and the GDS 2020 results show a continued rise in recruitment of new users, as the graph in the right indicate, that suggests real growth in the consumer base using these sites, despite the possibility of scams or market closure, or despite police interventions, as we will see. But here in the graphs in the left, we can see that to the question obtaining the drugs from deep web market in the last 12 months has increased year by year. And the graphs in the right indicate that most people first obtained drugs in the previous year using deep web markets. The next one, please. And the World Drug Report has used data from the Global Drug Survey, but unfortunately it has made very simplistic assumptions using this data. If we go to the next one, to the next slide. The World Drug Report have attempted to speak about the effectiveness of shutdowns of sites at the deep web, mentioning the data from the GDS 2018 indicates that deep web users used such markets less frequently or stopped using them after the shutdowns, at least for a few months, but not definitely. Suggesting that this temporary decline we see in 2018, I don't know if you get to see the bars in the graphic, that the decline in 2018 can be explained by the shutdown of major deep web drug markets in 2017, no? And these disaggregated data in the slide suggest that the proportion of users purchasing drugs in the deep web did decline between 2018 and 2019, as we can see in in all the regions except Europe. But it increased markedly in all regions afterwards, between 2019 and 2020. No? So this indicates that shutdowns might be effective only in the short term, but not in the long term. And when we do a close-up, we see this trend more clearly. If we can go to the next slide. These are countries with the highest responses of the use of the deep web among respondents of the GDS. And here we can see how shutdowns and police interventions may imply a decrease in the use of the deep web, but usually followed by a subsequent increase at least a year after. And the increases are more drastic each year. No? The next one. But when we look at this other graph, also in the World Drug Report of 2020 with data from the GDS, We can see that these market closures may have an impact in preferences among people purchasing drugs in the web, but data shows that this is a relatively small impact, as we can see in the chart, in the colors of the chart, no? And that impact has even decreased during the last years. These pie circle graphs show that only a few people have stopped using deep web markets or have used them less frequently after the shutdowns, but that amount of people has even reduced as the years pass, going from 9% or 15% in 2017 of the people that have used the deep web less frequently, but these statistics go to 6% or 11% when looking at the impact of market closures in 2019. And why? No? Why do people's preferences seem to be now less influenced by these police interventions than in years before? We don't know. We're not certain yet. But there are some trends that are worth noting, and the explanation that I have is that site owners might be sophisticating their platforms and the services that they offer to strengthen a key element in every business model, the customer relationship. And that takes us to how can we use technology to innovate and to actually meet the requirements and needs of people, in this case, people who use drugs, no? Shutdowns are obliging websites in the deep web to innovate and to create mechanisms that may build lasting and stronger trust with users for the relaunching of these portals or for the creation of new ones. And yeah, this graph shows this. No, we have a graph from 2020 inquiring about the most common sources used by people who use drugs to obtain their drugs. And as we can see, the digital sphere, the deep web markets, other portals such as apps, because yeah, we can use apps also to commercialize drugs, or open websites, is increasing in relevance. Deep web markets were more commonly reported for drugs other than cannabis, while apps were more commonly reported for accessing cannabis. And in this edition of the GDS, Televent, which is an app that I'm going to explain, was mentioned as one of the sources gaining presence too.
Just to mention that you have 1 more minute, please.
Yeah, I'm just concluding. Just wanted to mention that Televent is, as it is marketed, it is a platform that uses Telegram bots to interface with customers via a shop front inside an app, which is backed with a website based on the deep web, in order to manage orders and customers in a completely automated way. Telegram has been identified as a messaging app that people who use drugs already use, specifically for harm reduction outreach services. Telegram's founders have resisted attempts to censor its content or share information with authorities, and as a result, it is one of the preferred platforms for using or for sharing information about drugs. And this app has combined digital technologies to be more attractive, no, and to provide incentives for users to follow these interfaces, no, even after shutdowns. Can we go to the next? And yeah, well, that's an example of how Televent looks like. But if we go to the next, sorry. Yeah, and there are many harm reduction strategies that are already available when purchasing drugs in the internet, and particularly in the deep web. Online markets can promote community support, information exchange, harm reduction, and the use of these harm reduction strategies to improve interventions in the deep web can be retaken and implemented by governments. There is an opportunity to implement these services, substance analysis programs, peer education online. We can go to the next slide. And to make information on substances, on their risks, their benefits, more accessible, as some organizations are already doing in the cyberspace. No? The anonymity characteristic in the deep web provides the opportunity to conduct virtual accompanying information services to people that are afraid of facing stigma, discrimination, or repression. Televent is a good example of this, and yeah, the GDS is bringing lots of learnings from this data, which is also putting in evidence the necessity to support initiatives such as these surveys in order to have more interesting and honest conversations about trends related with drugs. And yeah, thank you very much for your attention, and I hope that we can have an enriching conversation with this information. Thank you.
Thank you very much, Jorge, for that contribution. Also kind of an analysis of this information, and importantly, also kind of making linked, of course, to the UNODC's itself War Drug report 2020. I would note, of course, I mean, we have a more latest one from last year, 2021, as you know, but I think a key message here is, of course, as you said, it's difficult to understand why even after the shutdown, you know, the people continue to be engaged in these activities. And I think one of the answers that you've given is that organized criminal groups have become very sophisticated themselves, have adapted to the measures from governments and law enforcement, of course. And this is one of the challenges, I think, that we all face to address this dynamic adaptation of organized criminal groups in response to measures from governments, from relevant organizations. So thank you so much for making sense of this, Jorge, and please stay with us as well for the conversation later on. Thank you. Ian, thank you so much once again for being with us. I think Jorge just made a very strong case of course, giving an example of data, a particular example of, you know, the dynamics online, who is selling what, who is buying what, and some of the challenges that we face there. And as you know, I mean, data also for all of us, of course, is key because it allows us to understand the dynamics of drugs and inform our interventions. So in fact, we know that, as Jorge also mentioned, that more data is always needed for us to better understand the links between various crimes, including cybercrime and drug trafficking, of course. So we cannot, I think, speak enough about the importance of data, and I think we cannot provide enough information about the importance of data. And so therefore, I would like you to let's say, go a step further, or to kind of take it from where Jorge just left off, and tell us, in your opinion, why is it important for civil society to be involved in gathering credible data? It's not just gathering data, it's really gathering credible and reliable data, and it's difficult to do that. And what are some of the challenges that civil society face in this case? And maybe perhaps there are some good practices that you have noticed in data collection, analysis, and evidence that you could share with us. Ian, please, the floor is yours.
Thank you very much, Billy, and thank you to you, the Swiss government, Vienna NGO Committee on Drugs, and the NGO Alliance for co-organising this, and thank you for the two really interesting presentations that we've just heard as well. For those of you who don't know the Global Initiative, we're a global civil society organisation headquartered in Geneva with offices in Vienna, Cape Town, and with other staff around the world, and we're very pleased to be part of this event as a member of the Alliance of NGOs on Crime Prevention and Criminal Justice, which is the umbrella body for civil society working to support the UNODC Crime Prevention and Criminal Justice Programme. When it comes to the questions you've just raised, I think the issues are quite complex, multifaceted, and constantly evolving. But a fundamental point is clear when it comes to all of these organised crime topics that we engage on, including the topic that we're talking about today. And that's what is clear is that it's vital to engage civil society in both understanding the types of illicit economies and the harms that they have on society, and in implementing effective whole of society responses to those issues. And I think this is recognised in the interactions we have, including this event and various other side events that we've had during the CND, as well as the kind of wide participation at the CND. And this is reflected in key documents such as the UNGAS 2016 outcome document. And we'd like to thank the Vienna NGO Committee on Drugs for driving forward that engagement here at the CND, along with UNODC Civil Society Unit. In terms of what civil society data looks like, okay. This graph is from some excellent research undertaken by Jason Eli, senior expert from the Global Initiative, looking at drug pricing across East and Southern Africa. And you can see from the graph how granular and how detailed that is on the different types of drugs, the months, you know, and how the prices were going up and down. And you can see from the quote on the right how essential it was to get community inputs into that data, including from people who use drugs. And in terms of the second point I mentioned, which is the responses, I mean, this is looking at organized crime more generally rather than drug trafficking online specifically. But this is from their book on the pandemic and how criminals responded to the pandemic, written by Tuesday Rotano and Mark Shaw, the Deputy Director of the Global Initiative. This quote here captures how integral civil society is to the collective struggle that we have against organized crime. They say that we need to make communities a partner in building safe spaces where people can grow up, live and work, and that it requires an investment in the growth and protection of civil society actors of all kinds. And that's about bringing back the public perspective into political and economic discourse. But there are challenges that we face. And there's still work to do both here at the multilateral level, but also at the country level. The space for civil society to operate at the UN and at the country level and at the local level is under stress across the board. When it comes to drug policy and transnational organized crime, this is especially true. And the International Drug Policy Consortium have published a very useful advocacy note this week that highlights how the ECOSOC NGO committee system is being used to shut out relevant civil society voices from UN processes. And this is something that we also experience here directly in Vienna. And it's not just civil society that's damaged by such restrictions. It's the UN itself, which then doesn't have access to certain data and evidence that it could be benefiting from when it comes to developing their policy. So civil society needs member state support and advocacy as well. Now, on the topic we're looking at today, the research that we have done through engaging with civil society experts to get that data over the years has helped us understand the criminal market dynamics and therefore to understand the challenges that we are facing. But we must acknowledge that there is a relative paucity in reliable data on online drug markets, and there is a need to go beyond the official statistics published by states on this issue. But we do have some overarching findings and specific studies on the issue, which are all informed by civil society data. For example, the 2021 study on the global illicit economy found that the internet has shaped illicit economies by widely expanding the customer base, lowering the barriers of entry for supply and demand and enabling greater anonymity and access to new recruits for employment and or victimization. Specifically on the illicit drug market, it found that the illicit drug market is active on both the surface and the dark web, where illegal drugs constitute the majority of products sold. On the surface web, consumers can buy substances that are technically legal, called legal highs or new psychoactive substances through online sites. On the dark web, the drug trade is characterized by low operating costs, high use of cryptocurrency, young tech-savvy dealers rather than cartels. And for the consumer, the risks of making purchases in open-air markets are reduced, and anonymity is easier to maintain. Illegal drugs are also marketed and sold on social media platforms, and consumers can comment, message, or contact the seller directly to make a purchase. Sellers advertise illicit substances through photos and status updates. And drug trafficking organizations also use social media to recruit low-level employees, such as couriers. Also at the macro level, the 2021 Global Organized Crime Index found that during the COVID pandemic, cybercriminal activity exploded, preying on the countless millions forced online for work, entertainment, and commerce. But we do have some more in-depth research, obviously not to the same scale as the Global Drug Survey that was just presented by Jorge. But on one study that we did back in 2020, we found that drug trafficking accounts for the majority of commerce on darknet markets, but that drug trafficking on dark web doesn't significantly alter the kind of underlying infrastructure of transnational drug trafficking. We found that supply routes from producer countries do not appear to be affected significantly by the growth in darknet markets, and producers continue to move their goods across well-established offline networks. And while the emergence of online markets, together with the growing availability of a range of information and communication technologies, it hasn't transformed the underlying infrastructure of the international drug trafficking trade. But it has catalyzed a number of shifts, which I'll go through now. Firstly, many drug trafficking groups exploit technology and apps to communicate. Trafficking networks are increasingly likely to rely on online financial transactions, including with the use of payment apps on smartphones. On the darknet, these changes have the greatest effect on the final links in the supply chain and on consumer markets, turning it more into a conventional marketplace where dealers can compete on price, quality, and service. Buyers purchasing drugs on the darknet typically use cryptocurrency, and products can be delivered anonymously. Online dealers can also require fewer employees and benefit from lower overheads. But there are some benefits which Jorge mentioned as well. In some cases, including on the darknet, this is allowed for enhanced accessibility in rating products. And this anonymity reduces direct contact between players in the markets. And in some cases, you know, when you're looking at rating and so on, it can have an interesting potential benefits from a public health perspective. And you have some listings as well, which are described as fair trade, conflict free, for example. But the ease with which vendors are able to post fake reviews, for example, or misinformation is poorly understood. And this raises its own challenges. With regard to the opportunities and vulnerabilities, which is the main point of this meeting, clearly, and UNODC know a lot about this already, there are lots of law enforcement challenges, although some successes in tackling the online drug trafficking trade. We can also see a balloon effect where things move to other markets. But from what we see, the responses that we've kind of recommended in our research reports focus on looking at the responsibility of online platforms, focusing on sites used by youth, focusing on the substances and the places where the most harmful things are happening. And those have to happen alongside better law enforcement and better regulation. And in taking this forward, we cannot just rely on the official data. We need to have holistic, community-based research and data, including people who use drugs, who know so much about how drugs affects their community and their lives. And also, in designing and implementing better responses, civil society must be protected, engaged, and supported to build their resilience, allowing them to do that engagement and to contribute to whole of society responses. And it would be remiss of me not to mention the Global Initiative's Resilience Fund, where civil society groups can be supported through funding and capacity building with the team at the Global Initiative. I think that's it for my presentation. Thank you.
Thank you very much, Ian, for that contribution as well, and also for emphasizing, I think, the point that was made actually just this morning by the chair of the CND during the informal dialogue with civil society in response to one of the questions about community resilience and community engagement in the context of drug policy, drug issues. And I think his response very much in line what you just mentioned, that community input in data and collection of data and in informing our interventions is quite key. So thank you so much, Ian, for that contribution, also for laying out really a lot of work that GI has been doing on this. Thank you. We have a few minutes still left on this side event, so I would like to ask our final speaker, Anna Alvarez. Anna is the chair of the NGO Alliance on Crime Prevention and Criminal Justice, and of course, the co-organizer of this side event. Anna, please, the floor is yours.
Thank you very much. Thank you. Actually, I think that we heard a lot of very, very important issues presented in the previous presentations, and especially Ian has already covered really the important concepts for the civil society engagement. What is important for civil society? This is also because I think Ian didn't mention that he has been involved in exactly this topic and how to engage civil society for already some time. And this is an important contribution that the Global Initiative is making to the work of NGOs in general. A couple of comments that I wanted to make that are really also based on my previous experience. Things move very fast. You know that the concept of dark web is not even 10-year-old. So it's something that 10 years ago we didn't even know about the dark web. So things move very, very fast, and there is a role for internet that is positive, negative, positive, negative. So the goods and the bads, they go in parallel, and this is really the important area that needs to be preserved together with the different stakeholders. So civil society has a diverse composition. So there is the media advocacy, there is the academia, there is the experts, and there is the private sector that has a big role to play in this. So a lot of the things to do are exactly the same that should be done in general. For example, for achieving goal 16 of the Sustainable Development Goals. No, we are talking about really maintaining transparency, maintaining strong institutions, making sure that existing legal obligations that they are really respected and enforced, commitments, etc., etc. So I think that the civil society role in making states accountable on their commitments, this is also going to work very well in this area. And clearly, I think it is important to make a distinction between the victims, who are the victims of cybercrime, and making sure that we don't make everything becoming a victimization issue, you know, so that there is a clear possibility to identify who is victimized and support who is victimized without victimizing further. Let's not forget that a lot of illicit trafficking of anything, trafficking of arms, trafficking of drugs, they go frequently together, and they may happen in part online and in part on the street, in part with the usual means. So it's very important also to make sure that everybody keeps their eye open, and this is an important role for civil society as well. Thank you very much.
Thank you very much, Anna, actually, for summarizing the side event and for helping me in doing so. Thank you so much for that. And of course, as the main umbrella organization partner to UNODC with regards to crime issues, I think the role of the Alliance will be very key in guiding the efforts of civil society organizations to really take this discussion forward and to come up with innovative solutions, because I think we see the message from here is that organized criminal groups have become very innovative. I think I think it was one of the participants of our events who said, you know, it takes a network to counter a network or to defeat a network. And this is, I think, what we are talking about here: partnerships, sharing of information, sharing of experience, cooperation, learning from each other. Some are more successful than others, and therefore I think those who are less successful, they can learn from those who have actually good experience in the work that they are doing in this context. And I think the other important message that came out of this is that civil society still need member states. They still need states in order really to make significant impact in their efforts to addressing drug trafficking, drug use online, because in the end, it's going to be about the policies that are put in place by those states. And I think the other key message that came out of that is that civil society have to hold member states accountable to their obligations within the international instruments. And this was also highlighted by UNODC this morning, again, during the informal dialogue with the chair, where the role of civil society was highlighted as important because it does inform UNODC. At least it helps UNODC to understand how member states are living up to their commitments on the ground. So it remains to be extremely important to have civil society engaged in these discussions and coming up with innovative solutions. So colleagues, I know it's CND week. Many of you already are going to the next event or to the next session. Others have many other important matters, of course, to attend to. I have been looking in a chat. Some of the questions that were posed there have been answered by the respective speakers. So unfortunately, we're not going to have time for questions, but I would urge you, if you have any questions or further comments, please do send them to us. My colleagues would put perhaps an email address where you can find us, but also the Alliance is always there available. GI Talk is always there available. And if speakers would like also to share their contacts just for further questions later on, please feel free to do so. So on behalf of the organizers, on my own behalf, really thank you so much to the speakers, and thank you to the audience for joining us, and all the best to you, those who are following the CND, and of course, all the best to you, to those who are doing many other things around the world where you are. Thank you, and all the best to you.
Thank you, Billy.
Thank you.